I intend to cover 3 areas. The management, the challenges will be to diagnose well, because the diagnosis of dementia is a very powerful diagnosis. It sometimes deprives you of the rights, this mental capacity, Secondly, you must manage well, and thirdly, we must support well. This is probably the first paper in the world published on the natural history of dementia. This is very important for all of us who are doctors, and even those who are in the mental health field or the health service. Because often the family will ask you, how long will my father or my mother live? I asked this question to the professor of psychiatry at Cambridge some 30 years ago when I was doing research at Cambridge. And he told me 5 years. If you diagnose someone with dementia, that person will live for 5 years. But this data comes from, what I'm showing you, the data comes from the memory clinic of NUH, where we worked for many years. And the authors include Dr. Emily Ho and Tan Hong Yi. We're all part of this team. And we have massive data. The memory clinic in NUH started in 1990, the first memory clinic in Asia. We have massive data. And you see that it's not 5 years. The average duration or life expectancy of a person with dementia is about 12 years. So if I see someone in my clinic, I can tell them it's about 12 years. Start with mild dementia, 6 years. Moderate dementia, about 3 years. And the final phase is the severe dementia, about 3 years. So on the average, about 12 years. So that families can prepare, for. So the first part of it is on diagnosis. How do you diagnose someone with dementia? There are many. So for the GPs are often the quandary about diagnosis. If someone having a memory problem, is that dementia or is it normal aging? Now there are rating scales to help you to screen. But we also know that for a family doctor or GP clinic, time is premium. You have about 20 minutes per patient. And time is never on your side. Some doctors ask me about the mini-mental state examination. Well, that's a very good questionnaire, but it takes about 20 minutes to finish, all right? And moreover, the person who constructed this questionnaire, Marshall Falstein from Johns Hopkins, he has also filed a patent. So if you use the mini-mental state, you have to pay him $10 US. And in the mini-mental state, there's a question asked the old person, spell the word world backwards. Some of my patients in Jurong or in Chinatown, they can't even spell the word world forward. You ask them to spell it backward. So it's of little cultural relevance to people. Now, the other doctors in Singapore sometimes use a questionnaire called the Abbreviated Mental Test, AMT. I've used it 45 years ago in the UK. And in England, there's a question they ask, when was the First World War? I've asked my medical students, when was the First World War? And the medical students are the cream of the crop. They can't even tell me when was the First World War. If the doctors don't know when was the First World War, I think it's unfair to ask a patient when was the First World War. So when we're doing the World Health Study, the big man at Geneva told me, why not with all the massive study, can you all construct a questionnaire that's more relevant for third world countries or developing countries, a questionnaire that is not biased towards culture or education. So we came up with one questionnaire called the Elderly Cognitive Assessment Questionnaire, ECAQ, all right? It's a 10-item questionnaire. You can finish off in 5 minutes. It can also be used by a nurse or even a psychologist or a social worker. So you don't need a doctor to do it. It's a screening test. And there are more than 10 PhDs using this questionnaire. So by the way, it's free. If you want in Malay or in Chinese or in English, write me a note and I will send you a copy of this questionnaire. Now I will move on to the management of people with very mild dementia. What can we do? This is the phase. If you do something for them, they can live on beyond 6 years. I look after a surgeon. He went on for 10 years, with good quality of life. All right. So the management will be next, please. Right. It starts with health education. From the NUH massive data, we realize that many people with dementia have also hypertension and diabetes. And if we were to if we stabilize hypertension, diabetes, it improves the quality of life and it prevents a rapid deterioration of brain function. This was something we told the World Health meeting 15 years ago. But at that time, there's not enough data. But now the data is overwhelming that hypertension and diabetes are risk factors. Think about it, people with vascular dementia, if the blood pressure goes up too high and there's a stroke, it will affect the brain function. So this is something very important. So we try and tell the family, can you stabilize? We help you with that. Besides education, the diet, remember take your medication. The second one is cognitive enhancement or mental stimulation. I'll go through it later on. The third is medications. Next one. Medications, all right. So we have, I think that the list is been shown up earlier on, and you're all familiar with your donepezil and rivastigmine. Not many people use galantamine. I use galantamine because during my training at Cambridge, they were doing the trial in Cambridge. So galantamine, very much the same, and also memantine. So some of these medications can be used. Now then, what about the mental stimulation? The mental stimulation is based on the research that's done at Jurong, and this is the first study in Asia on dementia prevention. Right? So the Jurong aging study, a 5-year study, is conducted at Jurong Point Shopping Mall. The first time in Asia that a research team is anchored in a shopping mall. And happens that the person who owns the mall is a friend of mine, and he agrees to allow us to the team down there. The rental is very high in the shopping mall, about almost 10,000, and he paid for it. But what we did in the study was people living around the Jurong area, those we assessed them, those high risk of dementia, we call mild cognitive impairment. We brought them down to the shopping mall, and the first part of the assessment was health education. And the second part, we divided them into 4 groups: Tai Chi exercise, mindfulness, music, and art therapy. And the paper, it was only 2 years into the study, and the Lancet people heard about this study, and they told us, I think you better publish a paper quickly, not to wait for 5 years. So part of the studies was published in the Lancet. And we also do a RCT, a randomized control study on mindfulness, because I think mindfulness is important for mild dementia. Mindfulness helps you in your concentration, your awareness. The whole circuitry of memory begins first with concentration. You cannot concentrate, you cannot remember. The second phase is storage, is where people with dementia have problems. And then the third phase of memory is retrieval. Concentration, storage, retrieval. This whole circuitry is called memory. So if you improve your concentration, then your storage and your ability to remember will become better. So we did an RCT, use MRI scanning, and we compared 2 groups. One group, people with health education, like all of you now, listening to me as a health education. The second group, people with mindfulness practice. And so we have 2 groups of people. And for mindfulness, with the man down there, Mr. Wee Sinto, who was then the Vice President of NUS. He has been 30 years of training in mindfulness, been to India, to Sri Lanka for training. He was an expert, probably the best person in Singapore. He passed away recently. The person who conducted the study of health education is none other than Professor Goh Lee Gan. At that time, the top teacher in the Yongludin School of Medicine. And so we have head-to-head between the top person teacher and the person who is a mindfulness. And you see the second the second slide, we show that the brain, the MRI scanning shows an increase in nodal activity, not only for the people with mindfulness, but also for people with health education. We also collaborate the results with detailed neuropsychological tests, showed improvement in concentration and also memory. And this is what happened after a year. He found that the green bar are the people improvement in the memory, and about 20% and 20% being stable. For that group of people, the mean age is almost 70 years, the memory will continue to go down. The red one, they continue to decline. But 20% improve, which is wonderful, because if you can improve the memory of the elderly people by 20%, in terms of cases that you save is tremendous. Every year we have 250 new cases, 2,500 new cases. 10% means 250 you can save. If it's 20%, 500 cases you can save. So besides that, we also do something on art therapy. So the art therapy study was in fact prompted by our ambassador at large, Professor Tommy Koh. He was then the chairman of the National Art Council. And he sent me an email and said, do you like to do a study on art and dementia? I said, why? Oh, it's reported in New York Times. In America, in New York, they're doing a study on whether art itself can help people with dementia. I happened to be in New York sometime later, and a friend of mine who knows the director of the Museum of Modern Art, MoMA, I went over there to see the study, and they brought me around, and the curator will show them the paintings at the Museum of Modern Art. That's where the biggest collection of paintings by Pablo Picasso and also Vincent van Gogh, all the paintings down there. But I told myself, I don't think our elderly in Singapore would appreciate Pablo Picasso or Vincent van Gogh. So we prefer painting as you see now, painting of Singapore River, painting of Chinatown. Then I told Professor Tommy Koh, we're not going to copy what the Americans are doing. We cannot just imitate. We're going to improve and do something better than that. We're going to get a group of people who are high risk of dementia, and we're going to scan the brain before the study and scan the brain after the study in 6 months. And it was marvelous to see the study done by Professor Rati Mahindran, the first author, and published in the World's Journal. And the first study using brain scan to show that art itself can improve the mental function of old people. I want to move on to the next one. This picture again, to remind you about the moderate dementia. Very often those with mild dementia don't come to see the doctors. The family will say, well, that's part of normal aging. But when they move into moderate dementia, when they are restless, they cannot sleep, then that's a problem. Then they'll come to see you for help. I look after an elderly woman. It was referred to me by the son. The son is a lawyer, and one day on Sunday after church, the priest told the son, your mother complained to me that you're stealing her money. So obviously the son was very worried, and then he was sent over later on for assessment, somebody with almost moderate dementia. But I want you to look at that slide down there. Is a PET scan, something up the street of Dr. Santosh. The one on the left is someone with normal aging. The one on the right is somebody with dementia. And you'll see that if someone with dementia, there are less of the red areas. The red areas is increased glucose uptake. Your brain is working. So if I were to scan your brain, if Dr. Santos will bring a PET scan now and scan the brain of any one of you here, you'll see that they'll be more like the one on the left side, a lot of red areas. But you see the one on the right side with dementia also have red areas, which means that in dementia, it's not the whole brain has gone off. It's not a global deterioration. I used to sit in the World Health Organization for the International Classification of Disease, ICD. And every 6-7 years, the World Health will call all some of the professors for a meeting and say, can we relook at some of classification. Is there new diseases coming? So when this was put up, I told them that the definition of dementia is wrong. They say, why? I said, because it's not a global degeneration. So they agreed with me. They took off the word global. It's just deterioration. Which means that along the red areas, there are many things we can do to help the person. Right? So I'm going to move on to some of those symptoms. So these are the moderate state dementia. They often complain of delusions are false belief. They've said about that women will complain to the priest about the son stealing his money. And also I find that in Singapore is the poor domestic helpers always blame everything. Oh, she has stolen my watch. They create a lot of turbulence in a family. And also in the evening, sometimes because of the shadows, they misinterpret the environment. They have visual hallucination. We call it the sundowning effect. And also they become restless. It's because of these symptoms that the caregivers could not tolerate, and they'll send the old person to see the doctors. So it's the behavioral problems that often comes up to see the doctors. But what can we do then? All right, very important to exclude infection. Sometimes when they have a dementia and then they have a urinary tract infection or even the upper respiratory tract infection, they go into the phase of a mild delirium. So in that phase, probably I wouldn't want to look after. I'll probably ask Dr. Vina to look after. So the team works in that way. And sometimes they have pain, maybe a fracture, and sometimes they have constipation. And another one, which is, I should put it in, is polypharmacy. So sometimes they will see various doctors, and they have 6 or 7 bags of medicine, and all this medicine adds together and cause acute confusional state. All right. So you have to be very careful on that. I look after the wife of a prominent tycoon in town, and because you're a tycoon, whenever the wife has diabetes, you see a diabetologist. With hypertension, see a cardiologist, lots of doctors. And unfortunately, doctors were not talking together, and she had almost 25 bags of medicine. And one doctor saw that she was a bit down, said, oh, you need Prozac, give her antidepressant. So when it's referred to me, because she was very confused, and I told her, maybe you take away all the medicine, except for hypertension medicine and the diabetes. And it's the Prozac that lowers the sodium level, and it causes a confusional state. In terms of the management of behavioral therapy, behavioral problems, behavioral therapy should be approached. So we prefer, if you can, to keep the old person in a calm and structured environment. Structured means there's certain days for food, certain time for exercise. And also to validate his feelings. Even though, as I said, he is old, he's forgetful, he has also feelings. And if you tell someone he has got dementia, it frightens the living daylight out of him. So often I'll tell the person, you have a memory problem. For example, yesterday I saw a retired nurse, and I'm not going to tell her, you have dementia, Alzheimer's disease. That's frightening to them. So I tell her there's a memory problem. But also tell them the good news. There are many things you can do to prevent a rapid deterioration. In the same way, when we teach medical students for treatment of cancer, oncology, don't tell them, oh, you take this chemotherapy, you will drop, the hair will drop, you will wipe off your sexual urge. No one will take that kind of medicine. You tell them that the medicine will shrink the tumor and you'll breathe better. So tell them the good news first. So even for this nurse, I told her that there are many things you can do. And because in the early phase of dementia, I can tell you it's at least 10 years more for you. There are many things you can do. All right? And also validate their feelings. It must be very frightening. Even I look after doctors who have dementia. It's very, very frightening to be told you have dementia. So what can be done? What are things that we can help you improve your quality of life? All right? Even though there is no particular drug to treat dementia, there are many things we can do. There's a French writer named Albert Camus who won the Nobel Prize for Literature before in 1938, and he wrote a line, where there is no hope, we must prescribe hope. So I think even talking to old elderly person, speak clearly and loudly, And then there are a lot of activities, what they're interested in, art, music, even exercise. And the final part is education for the caregivers. We have also written books, booklets on what to do, where to seek help, where to look for a day center, very important. Next one, please. I think for medication, which doctors like to give, the common ones I use with quetiapine, risperidone, and sometimes valproate. Some of my colleagues like to use valproate. I think it's a low dose of quetiapine, risperidone, but try and monitor the side effects. Sometimes it brings down the blood pressure. Okay, start at a low dose, and the next slide. Okay, so support well. I think the caregivers support very important. So I tell some of the caregivers, if you have any difficulties, you can send me an email or send me in the chat group and let me know how things going on. The GPs are looking after also need support. Sometimes they will see the GP, sometimes they can't find a specialist, go and see a GP. And how do we reach out to the GPs? I'm glad that they have our handphone, they will email me or they will send me a note and they see what we can do. A seniors hub, I mentioned the word hub because sometimes I send the old person to a day center and they get very upset. Why they send me a day center? Day center is for children, kids and all that. I'm not a kid. So we thought maybe use the word hub, is a better word. I'm not too sure whether there will be a hub in the Farrer Park Hospital. I'm sure the CEO, Timothy, is listening in. I'm sure you think about a place that people can go together, provide some support. And home visit, I do a lot of home visit, but sometimes they are petrified of coming or leaving the house or going to hospital now, and home visit is done quite regularly. And respite care, if a caregiver is looking after someone with dementia, is very, very taxing. We published a paper on the stress of caregivers, published almost 20 years ago. It's very high, So 2 months ago, one of the caregivers wanted to take a break. In England, where we worked before, respite care means we send an old person to a home for respite care. Here, I told the family, maybe you keep your parent at home and you go for respite care, a staycation somewhere in Sentosa, and have a break and come back. All right, so the last slide is something that I want you to, I think, next slide, please. Well, this is the most expensive painting in Singapore, and I happen to own it. It's called An Undefeated Mind. And in the management of dementia, very important for us to instill on them that not to give it up. So the mind must be ready to take on and to learn new things, and not to give up. And so the hope is important. And there's a house down there. Someone asked me, what does the house mean? The house means a home. The family care is pivotal, very important in our care. And what's the name? What's that tree? It's supposed to be a Tembusu tree. And I told them this tree means human values. And the values of care, the value of concern, the value of compassion, the value of respect for the old person. Because someone with dementia is very frightened. And how do we convey news to them? How do we convey the bad news to them? And how to talk to them in a way that a sense of empathy. And so it's important not only for the care person to the elderly person, but also to the caregivers. And also for doctors, how do we convey this message to them? So that's very, very, although it's the software of it, but I think it's very crucial. The treatment is not just giving you a drug and off you go. It is the building up a relationship between the doctor, the team, and the patient and the family. Thank you very much.